the country's COVID-19 pandemic cases increase, with health specialists urging government to impose stricter restrictions, young people have not been spared. To highlight the impact of COVID-19 on learning and institutional support during lockdown, the Higher Education, Science and Training has released the social impact of the COVID-19 pandemic on youth in the post-school education and training sector in South Africa report. The study involved young people between the ages of 18 and 35 years of age who are either in some form of educational training or enrolled in a tertiary institution in the 9 provinces. It found that 53% thought they were at low risk of contracting COVID-19, 15% themselves perceived as high risk, and 41% were not able to purchase their own food during the lockdown. To give us a little bit more about this survey, we are joined by Professor Sibusiso Sifunda. He's the Chief Research Specialist in the Human and Social Capabilities Division at the Human Science Research Council. That's the HSRC. Prof, thank you. It's wonderful to have you here on the program.
Thank you, good morning, and thank you for having me.
So I must say the one thing that really does stand out is that the issue of the fact that so many of those that are surveyed were not able to even get food during a lockdown. I mean, 41% not able to purchase their own food during this lockdown. That is a very difficult one to comprehend.
Yes, I think food insecurity really was a big problem due to the hard lockdown. And if you look at that number, it's actually somehow linked to the number of students who had to go back home. And as we know, a lot of students don't come from well-to-do backgrounds. So when they went back home, the entire kind of food safety system that's provided by universities, and especially in RES, where you get meals, was almost removed immediately. And that's why these numbers are actually telling us that by going back home, without any preparation, it led to this kind of situation.
Yeah, it really is. I mean, this has had a devastating effect on all sectors. It doesn't matter where you are, where you come from. It really has. COVID has not sort of escaped anybody. And now focusing in on this age group between 18 and 35 years old, there are many telling signs that have come out of this report. And I suppose we should start also having a look at that. 53% of young people thought that they were at a very low risk of contracting COVID-19, and 15% found themselves as a high risk. So when we look at this, I mean, it almost confirms the fact that we think the youth feel that they are invincible and that they're okay, and that chances of them getting it are very low, whereas numbers don't say that. So talk to us about that and how the behavior of the youth was interpreted through this survey.
Yeah, we expected to find this, especially if you look at the information around COVID. When it started in the beginning, it was really mentioned as a disease affecting older people, and young people were not really affected. And of course, this was around the first wave. And so these numbers are actually showing us what younger people were thinking and sort of believing at that stage. But as the pandemic changed, and we saw in the second wave that more younger people were getting affected. So this may have changed, but it still shows, because this is really higher than what you get in the general population in terms of people's perceptions of being at risk. And it's one of the issues that still need to be addressed. I don't think things have changed. You may know that the second wave started when young people started having matric parties and all this kind of clusters of outbreaks that were happening because young people just didn't care, and they were having their end of the parties on the coast. And so it still really is an issue, and I don't think it has been properly addressed up to this point.
Yeah, and like you say, I mean, this is still something that we need to find out a lot more about, because, you know, the youth they feel that, yeah, we were there, we know what it was like. You want to go out and enjoy your life, and you don't have to worry about these things. However, the science is speaking very differently, is that the youth are getting infected and they are spreading, and it's a very dangerous thing as well that people need to know. But if we look at the youth, and I think one of the telling things as well that stands out in the survey, I mean, the one about not being able to feed and feed yourself and eat is a big thing, which we've spoken to, but the other is that psychological and mental illness that it is having on the youth of today. Perhaps you want to talk to that for a bit.
Yes, psychological distress is pretty much critical, you could say, for almost everyone, but for young people it might probably even worse, because the fact of just being told that shut down everything and go back home, to a lot of young people, you know, it was unexpected, and it really must have caused a lot of distress. And that's what our study shows, and that actually there was a lot of such psychological distress caused by the hard lockdown, and just literally the disruption of their life. Especially, it shows more prominently amongst the younger learners, students who were pretty much new in the university system, the 18 to 19-year-olds. If you compare them to the older students, they show a much higher rate of psychological distress. And it's easier to understand because they'd barely been on campus for 2 months or so. I think it was probably 6 weeks at most, and pretty much on orientation phase. And then they were just told that your university career is almost kind of coming to a stop indefinitely, and nobody knew when they were going to come back. So that's why they actually show higher levels when we unpack our data, when you compare to people who are probably in second year or third year with much better support systems and networks in universities and colleges.
You know, one thing I need to point out is that the survey was actually done during the first wave of COVID-19. So this was, you know, in 2020 when we saw that first wave. Subsequently, we are now in the third wave. So we've been through that very high second wave that we saw in South Africa. Now we're entering into a third wave. Do you think much would have changed from the research that you did then to the research now? Because, yeah, I mean, we're heading into almost a year that has passed since the survey was done.
Yes, definitely. And that's the thing about surveys. They tell you what was happening at that point.
Yeah.
And some of the things we're really recommending is to actually look at what's happening now. I think over the last 12 months, it's a year after, we need to find out what's happening now. And a lot of things definitely have changed, from people's perceptions to even the institution's ability to deal with online learning and the hybrid learning system that students have to actually be part of at the current moment. So there's definitely been so many changes. There's definitely probably a better picture of how things are now. And one of the things as the HSRC that we need to do is to actually to find out what is happening now. And so there's plans to do a phase 2 study that's going to give us the picture of what's happening now. And hopefully we're going to find much more depressing findings, as you say, and we hope for the best. But I really think, I don't think things are as bad as what was happening around June last year when we launched this survey.
Yeah. So that's, I mean, we've got to keep that in the back of our minds. Things are constantly changing. There was one statement from the minister who was talking to the findings of the survey when he released it yesterday. He went on to say that that this did not paint, the findings did not represent a bad picture at all. He said that the higher education sector had managed to deal relatively well with the COVID-19 pandemic, and also a feather in their cap for having completed the 2020 academic year. How do you react to that? I mean, would you say that this is a correct interpretation into it that the minister is saying?
Yeah, I think what really happened last year, the department, especially government, I could say they started, in a way, paying more attention to science, because we did a series of surveys as the HSRC, and we find there was more willingness to engage with us by the government departments in terms of when we tell them this is the situation based on the survey that we do. So what the minister is really saying is, there was kind of better engagement, and some of this information we would even, as you know, we would actually share with the government departments before we even make it public. And so a lot of their responses were based on what we're saying, that we looked at this and this is what we found and this is how we think you should deal with it. And one of the issues that I could say is that there was no total disruption of the system, because there was at some point where people would think that the year was gone. So I think the minister is referring to that one of the biggest things was that 2020 could not be lost as an academic year, and so the government was constantly in basically trying to save the year, because a lot of people really were saying just this year is done. It's people are not gonna do anything, you won't graduate, you won't finish your studies. And it was through engaging and looking at what data was saying that basically everything that could be done was done to try and save the academic year and make sure that even those who were in matric were able to write the exams, and those who were due to graduate, pretty much you'd say most of them were able to achieve that right in the middle of the pandemic that we basically coexisting with now.
Let's speak about where we are right now. So we are in a third wave. We introduced the conversation saying that some scientists are calling for tighter restrictions. The numbers are they're not looking good at all. And, again, this is something that we've been told, that we are going to be entering into different levels of the lockdown as we learn to live alongside the pandemic. What are you thinking in terms of where we're at as a country? How should we be handling this as we see ourselves move into this third wave?
Well, the issue with the waves, it's sometimes it's like everybody says it's going to happen, and it's not when, it's if it will. And as an epidemiologist, I always say, we know what causes the waves, but sometimes we just don't do what's required. I can tell you, for instance, we knew the second wave was going to happen in December, because everybody wanted to have a normal December where you go back to your village, you go back to wherever you come from to have a normal Christmas. And the waves are really based on that kind of thing, where people think I'm entitled to go back to Limpopo, for instance, because I always loved to have Christmas Day. But I think we may be having issues with communication, because I can tell you in America, they were saying, don't go back home for Thanksgiving. And any American wants to go back for Thanksgiving. But in South Africa, our communication was really not clear. And that's probably one of our weakest links, because we were not giving people the real clear information. How do you prevent the wave? The wave does not fall down from the sky. The wave actually really happens when people do certain things that they probably shouldn't be doing in the time of COVID. And so the third wave is really arriving here, and all we really need to do is people to just change. You don't deserve a birthday party now. Your big wedding is not, this is not the time to throw a huge wedding or your huge traditional ceremony that you're entitled to that happens in winter. We know we have lots of things and other ceremonies that will happen around this time. Of course, they're going to be part of the clusters that we see that are part of the third wave. And that's really what we need to be communicating there. And everybody knows what needs to be done.
Yeah. And that is the reality. I mean, we speak to, you raise an important issue, and here I'm thinking we've done enough on communicating and educating people and telling people what it is, how it's spread, the interventions from mask wearing to sanitizing to avoid gatherings, indoor places, rather keep it outdoor. I mean, we speak about this all the time, but from what I'm gathering, is it enough though? I mean, even from the surveys that you did you find that the students and those that you spoke to had enough education, or is that something that was missing?
No, the education is simple and basic. I think one of the issues in South Africa is the tendency to complicate really basic things. When we started communicating about COVID in the beginning, we were really talking about the prevention protocols that people need to follow in order to avoid infections and cases amongst our communities. And they were really basic, they were talking about mask wearing, the whole thing of shaking your hands with your elbow and not sneezing or coughing into your elbows. So these protocols were kind of being put out there and we were kind of communicating them better. But people start getting fancy and then they change the COVID prevention protocols and use terminologies that are causing even more confusion. Like this non-pharmaceutical intervention. What is a non-pharmaceutical intervention and where did it come from? And does a granny in the village understand what a non-pharmaceutical intervention is? And that is the problem. You must communicate one message and communicate it consistently. South Africa, we start getting fancy. And of course, there's the ego of this is my new term and this is how we're going to communicate it. And that's where people get confused because they don't know now. What was the protocol of preventing yourself from getting the virus versus now the new fancy terms that we like to use? And then people get confused and then they just say, oh, I don't know what a non-pharmaceutical intervention is and how does it even relate to me and the life I live in the space where I am. So that is the problem. You need to communicate. And the HSRC as a Human Science Council, we actually probably one of the best placed people to communicate to the human level and to communities in a simple and uncomplicated way, because you cannot use your big terms. If I use the terms that I've specialized with to talk to the average man on the street, of course, none of them would know what I'm talking about.
Let's leave it there for this morning. Thank you. Thanks very much, Prof, for talking to us here on the program, just giving us a look into a research that they've done. That was Professor Sibusiso Sifunda. He's a Chief Research Specialist in the Human and Social Capabilities Division at the HSRC. And they're talking about higher education, science and training. And it was released a social impact of the COVID-19 pandemic on youth in the post-school education and training sector.